to the Starry-Eyed podcast. My name is Brendan.
And I'm Jen. On this show, we chat about all things Williams syndrome.
The ups and downs and what it's like living with.
And being a parent to someone with
Williams syndrome.
We're excited to share our community with you. Thanks for being here.
Transition to this interview with Benjamin Jacob is going to be a hard edit because he started so organically.
I know.
And you guys just kind of took off. I'm not even sure we're going to be able to, I'm not even sure we got his name out properly. So
I don't even know either. I know.
I don't think so.
Ben Jacob at Texas Children's. That's
Yes, Ben Jacob.
We're gonna talk about it right in the beginning. So we'll talk about it in our intro. We better get our poop in a group here. But yeah, he just started and he was like so well spoken. I'm like, well, I'm not going to make you stop and redo it. Let's just go. Okay. I love it. I love it when people are prepared. He's an Enneagram 3. You can tell.
So happy February, everybody.
Yes, happy February.
Dude, I cannot believe it's February. Dudes, plural. I can't believe it's February.
First week
of
February.
Good podcast today.
Oh my God, it was so good.
So good. Yeah, first up is Jess Stranz.
It was pretty cool.
She has a great smile, and so for those of you listening, you'll have to go check out our video portion of the podcast because she's you can tell she's like a sweet girl, and she loves her life, and she just is. The conversation made me happy.
Mm-hmm. Yes,
a lot of good stuff out there.
And then, then Ben Jacob, Benjamin Jacob from Texas Children's. Man, yeah, he came in. He full disclosure to people watching and listening, we had an interview cancel on us, but we really wanted to talk about National Heart Awareness Month.
Yes.
And he came in and knocked it out of the park. Holy buckets!
Yeah, he was so knowledgeable. So February is CHD Awareness Month. It is Congenital Heart Defect Month. I think it is Heart Awareness Month in general as well. But for many in the Williams syndrome community, we are impacted by congenital heart defects. About 75% of our population can have one or more. So it's a really important topic. And Ben just the minute we turned that computer on, he was coming in hot with all the information. It was amazing.
So the people who are listening to this on their devices and maybe have seen the tile come up, and certainly if you're watching this on YouTube, you'll notice that the podcast looks a little different. The logo is a bit different.
We had a refresh. We had a
facelift. Yeah, we did.
We got a full refresh. We revamped, and we
Brazilian blowed out this whole podcast.
Just like my hair.
There it is.
Just like my hair, guys.
Yep.
But yeah, so how it started was Joel accidentally deleted a very important file and couldn't find it again, and so was going to have to redo the whole beginning of the show anyway. And so that started a conversation of, hey, when we started this show, I just came up with that logo because we needed something. This allowed us to say, allowed us to all kind of, what do we want this logo to be? What do we want it to say? What do we like about what we have? What do we want to change?
Well, and really the old logo was great, super cute, loved it. Really the change that we made, there was kind of two small changes, right? One was we wanted to make the logo a little bit more accessible to our friends in the disability community. And I recognize that maybe that does not apply to people with Williams syndrome, but you or people with Williams syndrome may have other friends that have disabilities, right? But things like color blindness, things like being able to read certain fonts, or like I said, certain colors, that can be important when you're talking about accessibility. And as accessibility is so important to us, we wanted to create something that that honored that, right? And represents, truly what we're trying to do here. So Joel did a great job of taking all of our demands.
Yeah, no, they weren't demands. They were wonderful, wonderful suggestions. Yeah.
We're trying to be more inclusive. We're trying to be more inclusive, and that is our number one priority. So we hope that you enjoy the new look.
Yep.
We changed the name. We dropped a part.
We did. We did.
There's really no great story behind that.
Well, no, there's not. I mean, I will say, I sort of felt like the old title was a little too clever by half. We're just like, hey, we're a podcast. We're not, we're the Starry-Eyed Effect. Like I was thinking about the Jimi Hendrix Experience. We do a great
experience.
We're not quite Jimi Hendrix level yet.
Keyword being yet, but we'll get there.
We'll get there.
Well, thank you for a great podcast as always. I'm excited to hear what everybody thinks.
Yeah.
We'll see you in a couple weeks, everybody. Take care.
Bye.
Enjoy the interview.
Hey, Jess, how are you?
Good, how are you?
Doing well. So for those that don't know who you are, why don't you introduce yourself and tell everybody a little bit about yourself?
Yeah, sure. So I'm Jess, and I am from Michigan, Grand Rapids, Michigan. I am the fifth child of my family, and I was diagnosed in 1999 with Williams syndrome, and I have a fun, unique personality with it. So I love it.
So you're the baby of 5? Okay. So you got diagnosed pretty young. Okay. Tell us about how that happened.
So I was really tiny, and what happened was my mom actually gave me birth in 1999. So it was actually on my birthday. And then all of a sudden I stopped breathing. They had a lot of medical issues going on. My heart was beating too fast. And then about maybe several years after that, I took a fish test and it was positive that I had it.
Okay. So right away you had some maybe signs of having something, but then it was until, did you say a few months later that you got diagnosed?
Yeah.
Okay. So you were like a little itty bitty thing. How was that for your parents? I mean, I have 2 kids and I can barely handle myself. So I can't imagine having 5 kids and having somebody that has needs.
It was scary.
Yeah.
I mean, I was like, oh my gosh, am I going to live with this whole thing? Or am I it was my mom was very, she was scary. And so was my dad. I mean, they didn't know what was going to happen.
Yeah.
I was scared too.
What's the age difference? What's your oldest sibling? How old is your oldest?
So I have 4 other ones. So I have Anna, who is 29 years old, I think.
Okay.
And I have a brother, Joe, who is maybe 26. And I have a brother who is 27 and an older sister who's 30.
Okay. So yeah, your house was full of kids under the age of 10. Then you come along and you're diagnosed with Williams syndrome. Did you always grow up in Michigan?
Yes. Yep.
Okay. And always in the same area that you're in now? Okay. So tell us about that. Tell us about growing up in Michigan. You were probably the only person in your school who had Williams syndrome.
Yeah. It was scary, but I had fun growing up. It was, some of it was challenging.
Sure.
So I play bowling. So I do a lot of bowling in my family.
Okay.
Cool.
And my other siblings did softball and baseball. So that was kind of fun just to go see them travel around.
Big sports family. Yeah.
And a lot of it, I think it made me a different person just because I felt like I had all the stuff I needed to know about it.
So you remember childhood being really fun. How was school for you?
It was challenging.
Yeah. How so?
Because of the the diagnosis, I think it made it challenging because I had a hard time writing.
Oh yeah. Yep.
And reading. And I think my education was low. So it was very hard to get education back then.
Sure.
But now I think it's easier.
Yep. Yeah.
Because I'm home a lot and still doing things I enjoy. So now I'm working 3 different organizations.
Okay, three jobs. That's
Yep.
a handful.
Yep.
Okay,
Yeah,
tell
it
me
is a
about
lot. Disability advocates is one. So pretty much anybody who has a disability, or whether it's, their parents or grandparents, whatever, so on and so forth, they can call us and we can help them get housing, OT, like equipment, like any kind of walkers or anything that they need. So I run the front desk in my office 2 days a week, Tuesdays and Fridays. And then I am now in a volunteer for Special Olympics.
Oh,
So, yeah. And I'm doing their newer front desk. So I'll be doing that same thing as disability advocates. And then Be Nice is ambassador. And then just helping whoever needs help is what I enjoy most.
Right on. That's awesome.
Do you do Special Olympics?
Yes.
Okay. So does Brendan.
Yep. Golf and swimming.
I used to do bowling, but right now I'm kind of focusing on work a little bit. Just kind
Life
of see
life
where-
comes first before anything,
Yeah.
Work, anything that related like that.
Brendan, I didn't know you were doing swimming for Special Olympics.
Yeah. Well, I was doing swimming and then the pandemic hit,
Okay.
So it's been a while. But the last time I swam, I got 2 back-to-back golds for relays
Okay.
with my team. And then the coach that we had changed jobs. So, and I just kind of felt hesitant about, like, I didn't know who the new coach would be,
Yeah.
how I would fit into that situation. So I kind of just took a break and just kind of focused on golf. And then I got COVID twice back to back.
Yeah.
So I took the whole year off from Special Olympics to just focus on my health.
Mhm.
And now, fast forward to 2024, I'm, gonna do golf again. Hopefully swimming, so we'll see.
Yeah. And so what kind of health issues do you struggle with?
Heart issues, blood pressure issues, eye issues, ears, pretty much everything that people get with Williams syndrome.
Okay. Yeah. Tell us about the
It
eyes.
affects that.
Eyes and
So
ears.
my eyes were this way,
Okay.
Yeah.
and then so I needed them to go straight. So
Sure.
I had eye surgery. So it took a while to get normal, but I would get a lot of ear infections.
Okay.
Mm.
So like if I fly somewhere, I still have trouble hearing
Ear
afterwards.
pressure bothers you.
Yes, ear
Ah.
pressure. Yep. Heart, of course, I've back in, I think it was like 2014. That was my first surgery because my heart was going fast. It was
Yeah.
going to the point where I was scared enough to not know what was happening. So
Sure.
I had an 8-hour surgery ablation done. And then they kind of told me it wasn't going to come back at all. But then it came back again. So I went through the same thing like 3 different times. So it was like, oh my God, I was scared enough. Like,
Yeah.
Yeah, I had a cardiac catheterization when I was 16, around that age, 15, 16, because I had cardiac arrhythmias. So my heart would skip a beat, stop, and then restart. And so it was creating the sensation of having like mini heart attacks. Like I would get the numbness down my left arm, like really bad chest pain. So I had the cardiac catheterization. I had a stress test. They
Mhm.
almost had to put a defibrillator in.
Oh my gosh.
And then I was put on a heart medication, which has helped everything. They did the cardiac catheterization and I couldn't recreate the rhythm. So they just decided to put me on heart medication. And it's been a life changer. I mean, yeah, there are some times that I still have very minor arrhythmias, but it's not a big deal. Like I only have to see my cardiologist like once every year, so which is great. But I can totally relate to, what you've been through.
yeah, because it just, hearing them say, "Oh, you need this done, or you need that done." I was like, "No, I don't want to do it. I don't want to do it. I don't want to risk everything." And so they did like an 8 hour ablation on me because my heart kept going, thump, 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 thump,
Right.
thump. And then all of a sudden it kept going and going until it would go thump, 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 thump. And I was like, oh boy.
You can feel that when that was
You
happening.
can, I could feel it anywhere in my body. You just feel it, which is weird.
Definitely weird.
It doesn't matter if I'm sitting on my couch or in a chair or at work. I could just feel it coming.
But yeah, I was going to ask you, like, when does it seem like it occurs? It just can happen.
Well, 2020, I think it was. I was literally sitting on my couch playing with my iPad, and I usually would just watch airplanes for fun and entertainment.
Yeah.
And so I was sitting there, and I was like, and I feel so weird. Why do I feel so weird? And I would feel like, my chest was beating, my heart was like, dum, 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 dum. So I get this like weird rhythm. I was like, Dad, Mom, I don't feel good. Something's wrong. They're like, what? I said, I could feel my chest beating. My heart was beating. So it took me like I don't remember how long it was. Like an hour or so, just like to get it back to normal.
Yeah.
So now that I had the surgery done, I'm kind of feeling relief because I have AFib. So it triggers almost everything. So when people get AFib, it's scary.
I don't know what it is. So tell me what it is. I don't know what it is.
So it's people who have Williams syndrome or have heart issues, your heart is supposed to go 1 per minute, but mine went 2 per minute. So it's like you're like, I don't want to say like, you're like thinking. So like one time it's like almost where your heart is beating way too fast. So it's not getting back to the rhythm normal.
Yeah.
So they go in and they have to like shock it and restart it to get it back to normal. So it almost takes you like a couple weeks just to get back to normal from having surgery. Yeah, it was a nightmare.
Yeah. So you've been like dealing with some health stuff. Like, so in the midst of that, like, tell us like about your life. Tell us about, you work 3 jobs, which is like, super grind. Sounds like you don't have any free time, but like, what do you do in your free time?
Love antiquing. I don't know if anybody's an antiquer, but I 100% love antiquing.
Very cool.
So I like to collect all airplanes. Yeah,
like
I like
airplanes or just like airplane anything.
My whole entire room is full of airplanes. The reason why
things like that
I love collecting planes is because I used to have, I think it was like one of my grandparents went in the Coast Guard, or like I have one that went into the Navy or whatever. So I'm usually collecting each one of them, whether it's a 747 or 757s. I'm like that person.
Okay, so you know a lot about planes.
Yes.
Oh, yes. I heard you just say 2 models is there.
Yeah.
Has that always been a thing of yours, or is that just something new, like an interest that's developed? Okay. And what about like your bowling? Because you're an avid bowler, I hear.
I am. Yep. I love bowling.
Is it the same? You started that when you were young too?
My whole family did it.
Oh, really?
I had grandparents that did it. I had my father did it back in the day. My mom did it. My siblings did it. Yeah. So my whole family was a big bowling group. So and I enjoy it. So
yeah, are you on a team?
Yes. Okay. I'm on like this disability group on Mondays. So I go like every other spring and summer. So it's fun.
I don't know, you guys, Brendan and Joel, what would our team name be if we were bowling? I'm not a good bowler, so I would be like weighing you down.
I feel like we would be strike 1 to strike 2. I don't know.
The Starry-Eyed Strikers.
Ooh, that's a good one.
Yeah.
Pulled it up. Of course you did. Yeah, I'm a terrible bowler, but I like bowling. it's fun. And I think it's my daughter Stella loves bowling too because she likes the snacks. So she likes that she can like do something and then like have a pretzel. And it's a good way to keep like physical, right? I mean, because
Yeah.
if you're good at bowling, it's a lot of work.
I
Yeah. I
usually
mean,
watch the Pro Brothers first and then,
Okay.
like Jason Belmonte or Chris Barnes or whatever.
yeah.
I watch them and it's fun. How did your daughter get diagnosed? If you
My
don't
daughter,
mind. Yeah.
yeah, she was 5, and
Wow.
it was
I was
kind of
2.5.
surprise. Yeah, it was really like a big surprise. We had no idea. And
Yeah.
so it was actually a teacher said, it's kind of similar to Brendan, I think, where somebody had known somebody with Williams syndrome and then had said to us, hey, we think Stella reminds us of this person with Williams syndrome.
Yeah,
I'd
it
never
was
heard of it.
similar to that. They watched a documentary.
Oh yeah, that's right. That's right. Yeah.
But I wasn't diagnosed until I was almost 13. So which is crazy because usually people with Lyme syndrome get diagnosed at 3 to 6 months or at birth. And yeah, so first 13 years of my life were I didn't know and I was misdiagnosed with other things and then put on medications for those things and then properly diagnosed with the fish test. So yeah.
What's interesting, Brendan, is that this month, you guys probably both know this, February is CHD Awareness Month, in
Yeah.
addition to being Rare Disease Month. So we kind of get
Right.
like a dual whammy
Yeah.
for Williams syndrome. But I was thinking about it, and I remember when Stella was diagnosed, and so again, somebody said Stella looks like somebody with Williams syndrome, and so I Googled it on my phone. And the first thing I saw was that there was all of this heart stuff, right? And so
Yeah.
that was the thing that bothered me the most. That was the thing that caused me
My
the
parents
most.
too. Yep.
Yeah, stress was like, what does my child have something wrong with her heart and I don't know it? I was just wondering, Brendan, if your mom felt the same way.
Yeah, we were all really scared because things had been kind of happening here and there, but it just sort of came out of the blue. I mean, I had a overnight heart monitor on and my heart spiked from 140 to 200
Okay. Oh,
or
that's
40 to 200 actually.
scarier. Okay.
So we immediately got the call at like 11 o'clock at night, like you have to go to the emergency room now. And so my mom and I drove down and then
This is when you were 13, like before you were diagnosed?
no, when I was 16, when I had the cardiac
Oh, yes, yes,
catheterization,
yes, 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 okay.
that's what caused me to have the stress test, the cardiac
Okay.
catheterization, almost having to have the defibrillator in because I spent like 5 or 6 days in the hospital doing these tests and getting everything done. And yeah, it was crazy.
Yeah, it is crazy. And I mean, it is an element for many people with Williams syndrome that you have to manage. And that's what I talk about, right? Like, and you guys are similar in the sense that when you were younger, you didn't have as many problems, right? It was like as you got older that, some of these things come out. And so sometimes, like for me, I feel like, well, people probably think it's silly that I'm talking about CHD awareness because Stella just has like a heart murmur and high blood pressure.
I have heart murmur too.
You do? Yeah. Yeah.
I
Those
do
things,
too.
right?
Yeah,
If you
but I
don't
mean,
watch
it's
them,
not silly though. It's really not.
totally,
It's
totally,
a serious thing, and you know,
absolutely serious thing.
and
And
those people that think it's silly should get educated.
yeah,
That's, I always wanted to have people get educated. Like
yeah,
I educate my work on it sometimes, because if they have a kid, at home, maybe they want to learn more. And, of course, it's different now than what it was before.
I agree.
Okay.
Well, believe it or not, we're like already like finishing up your
Oh,
very first podcast with us. You've done so well. But before we close this segment out, I want to just give you the chance to share, if anybody who's listening, what do you love about having Williams syndrome? Is there anything you want people to know about Williams syndrome? This is your platform to share your words of wisdom, your experience.
yep. You have the floor, Jess.
If anybody who is listening right now who does not know, please look online. It has so many different things you can look up to, no matter what. If it's, somebody without a disability or with, they are so unique and so amazing with or without. And, for me, it was challenging because, I didn't know if people were going to think differently. And for my parents, it was scary, because they had to put a lot into it. And, I'm sure it's scary for your daughter too. So
Yeah, but for me, I mean, I'm speaking for myself, not for your parents,
yeah.
but it's a blessing, and there's so much that
Yep.
I get the privilege to learn along the way of the journey, and it's opened my eyes to a whole segment of a population that I wasn't exposed to before. And so I consider myself very fortunate that I, get this perspective,
Mhm.
because it makes life so much more impactful and fulfilling for me. And I think people with Williams syndrome are just so fun. And we were talking about, you haven't been to convention, but if you ever go to convention and you see me, like, we will just have so much fun, because it's just you guys are so caring. You have a lot of life experience, right? Much more
Mhm.
so than like the
Yeah.
average person to share. And you have great experiences and perspectives. Every single person I've met with Williams syndrome, you guys have shared something deeply impactful for me. So thank you, Jess. You
Yeah,
Thank
thank you.
you
have the best smile. I love your smile.
Oh, thank you.
I'm sure you get that
Yeah.
a lot.
Oh,
It's fun.
yes, every day, every day.
Good. Well, I appreciate you joining us.
Yeah, thank you for inviting me. This has been, amazing to educate people for sure.
Good.
Yeah.
I'm glad. Joel.
That's right. Yeah. It's been going for, I've been trying to get it going since 2019, but really it's just been going probably about a year and a half or so. So,
So this
yeah.
is just for Williams syndrome?
Yes, yeah. So I work in cardiology there at Texas Children's. I'm a PA there, and I joined that cardiovascular genetics group with the intention of developing a Williams program. My brother actually has Williams. That's why I'm interested in it.
Okay.
That's why I'm passionate about it, and kind of went into cardiology and all those things. So got a lot of both personal and professional experience with it. And so, yeah, we've been growing that for a little while. So it's exciting.
That's awesome.
Oh my gosh. Well, we normally have like a whole thing that we tell you, but you just started so beautifully. So we're just going to keep going. So your brother with Williams syndrome. I love this. How old is he?
He is, let's see, he just turned 33. So he's 4 years younger than me. Yep. So he had heart surgery when he was 10. And so I was 14 or so when that happened. So
Wow.
got to experience that and the hard things that went with that. So
Yeah.
February is CHD Awareness Month. And so Joel and I had talked about this idea of bringing somebody that has more expertise. Like, I have no medical expertise. So if I am trying to explain any of this to anybody, it sounds like a hot mess. So I thought it'd be fun to just like bring somebody on with this kind of background, right? To talk. And I love that you have a Williams syndrome connection, because you can maybe talk about it more intimately, just about the heart challenges that exist for those with Williams syndrome. But for right now, why don't you tell us like just about the Williams syndrome condition and how that plays into the work that you do in cardiology?
yeah. So Williams syndrome, as many people watching this probably know, a deletion on the seventh chromosome that includes a gene called elastin, or ELN is the name of the gene, but it codes for a protein called elastin. That is a very important protein in blood vessels specifically, and so that can affect how those blood vessels develop, change over time. And the main thing, one of the biggest problems we see as far as heart disease goes in Williams is vascular narrowing, or stenosis is the fancy word that we use for that. So really, it's just narrowings of arteries, and they can be at a couple different, they really can be in any vessel in the body, but the most common one we see is called supravalvar aortic stenosis, which is a mouthful, which is just narrowing above the aortic valve, which is the valve that leads to the biggest artery in the body. And provides oxygenated blood to the entire body. So that's the most significant thing that we look for, but there is plenty of other things that we watch for from a cardiac perspective in someone with Williams. And so I like to think of it as not just one single problem, but actually it's something called an arteriopathy, or it's a genetic change that can affect all the blood vessels in the body. So there's lots of risks that can come with that, even if you don't have that structural component, that narrowing, or one of those problems that sometimes needs to be surgically corrected. It actually can be a lifelong thing to watch for hypertension, for development of coronary artery disease long term. There's many things we need to watch for and screen for throughout the lifetime. And just because everything's good on an initial checkup doesn't mean that there's not specific things we should be watching for over a lifespan.
So what's your brother's name?
My brother's name is Jimmy. I call him Jimbo.
He had open heart surgery at 10. So
Yep.
I'm sure you know, like, what kind of things did he have, or what kind of issues cardiovascularly? And then, tell us more about how that just played into your journey of becoming a cardiologist.
Yeah. So he actually had a pretty typical supravalvar aortic stenosis, so that narrowing above the aortic valve that kind of progressed through his childhood years. So had a murmur since birth, which a murmur is just a sound that's created when blood goes through a narrowing or causes turbulence in the blood vessels, and it's a sound we hear with a stethoscope when we listen. So that murmur was what led to his diagnosis, which is why I think cardiology and pediatric cardiology is a very important piece of the medical treatment of someone with Williams, is because that's where they enter the medical system a lot of times, is from a murmur. We did some kind of background through our clinic at Texas Children's, and we found that we saw about 90% of the patients. We were by far the specialty who saw the most patients with Williams, because they would come to be evaluated for those narrowings and those murmurs. And so, but anyway, his narrowing progressed through his kind of 8 year after being diagnosed. He was diagnosed at 2, and through those 8 years, it progressed and got to a point where he needed to have surgery for that valve. And then actually during the surgery, they realized that he also had significant narrowing of the coronary artery, where it comes off of the aorta, which is coronary artery is the artery that feeds blood flow to the heart itself. And that can be something that is very under-recognized in the Williams population, and hard to diagnose, actually, because we can't see that very well by routine echocardiogram. Sometimes when we go to the cath lab, which is where they put a big IV in your leg and shoot contrast in there, it's really hard to see that by those catheters too, because sometimes you have to go into that artery to really get a good picture. And so it is really a tough thing to see unless you're specifically looking for it, and even then can be a challenge. And so they found that with them as well. So that's his surgery involved repairing both the coronary artery where it came off the aorta, and that narrowing in that supravalvar aortic area.
And so it was like when you were growing up, and that experience is like what shift you were like wanting to be a football player, and then you decided you wanted to go into cardiology?
Well,
or you
I mean, if I
wanted to be a doctor?
If I would have been better at football, I probably still would have chosen that. But I did play football, but I was not good enough to make a career out of that. So yeah, that really ignited my interest, hearing about or seeing what he went through, and hearing about the surgery and how they had to stop his heart and do all these things. And a machine was supporting him through that, and it's scary stuff, right? But I was like fascinated by that at the same time. And so through school and all that, I've always had a bent towards pediatrics for one, and then that had kind of pushed me towards cardiology, and thankfully that's the way my brain works too, is in a very physical, mechanical way, which is what cardiology is. It's pumps and valves and all those things, and so it led me to cardiology, which I've been doing for 10 years now. And then so the last 5 has been really focusing kind of on Williams care and in the outpatient setting, and having a clinic that runs that. So that was a big part of how I ended up where I am.
I've never been to a Williams syndrome clinic though, and like that is again in all transparency. What do you guys do?
Yeah, good question. What we're trying to do and what we're actually doing are currently two different things. So,
Okay.
what we're trying to build is a true multidisciplinary. So, having a geneticist, having someone in cardiology, a cardiologist, having people for endocrine and renal, and places that are experts in Williams that can be part of like coming to clinic and seeing them in the same day, right? Getting all that together
Yeah.
so that in one visit you can do that. That's the dream, right? So how it looks like right now in building a program is really it's just identifying those people and funneling patients with Williams to the same people. So you're developing this institutional expertise. And so I work with a geneticist that I send all the patients to. I work with a developmental pediatrician that I make sure I funnel those patients with Williams to the same developmental pediatrician because, as you know, it's rare, right? So if you spread out patients with Williams across the whole medical all the specialties, right? You might be the only patient with Williams that provider sees. And so the first goal is to get experts, right? And then it's to coalesce those experts into something that can really be beneficial for timing and more convenience and things like that. So that's why it takes some time to build those things. And so that the goal is to have that true multidisciplinary clinic where a person with Williams can be in the room and rotate through specialists and say, what do you need from renal? What do you need from cardiology? What do you need from genetics? What testing do you need? And making sure you're on that pathway. That's the dream. In practice, we're really just trying to get expertise and we're getting those experts so then the parents and the families aren't having to be the ones, which I'm sure you've felt before, explaining what Williams is and telling doctors what they need to look for and having to be the expert yourself, which is great in education and the family education is super important in that. But the way we do it in Williams is try to get the clinicians to be the experts and to be educating the families more, right? And having that kind of more well-rounded expertise that can care for the whole body that way.
What have you seen like in the short period of time? You obviously have experience with Williams syndrome, but has that changed since you've taken this new role on?
Yeah, I mean, of course, I've continued to learn a lot since taking this role on. But yeah, you said it exactly right. With the genetic change, right? Just having a genetic change as deletion does not equal severe heart disease, right? You can have a whole wide range from no heart disease at all to very severe, not only aortic narrowing, but also narrowing in the pulmonary arteries and needing multiple surgeries. Like there's this huge spectrum, and you can't predict just based on the deletion or the genetic test. You can't predict what heart disease you're going to have. So that's where, I mean, I think research and all that is a really important area to try to understand that what's changing that, what's making a worse vascular phenotype, right? Phenotype being the physical characteristics that we see. And so I think that, that's a really interesting thing moving forward is one, why there's this big variety. Is there ways we can modify that? Is there ways we can change that to hopefully have better heart outcomes? But yeah, you're absolutely right. Even those people with no heart disease, no structural heart disease, are still at vascular risk, right? Hypertension and stroke are still a problem and a concern, right? Long term. So anyone with Williams should always have a cardiologist, right? You never graduate from cardiology and say, you are now free from cardiology, in my opinion, because I think all the vessels are abnormal and have risks. And even if you're not having to get echoes every year or every 2 years, you should still be following blood pressure. You should still be watching for cardiovascular risk, watching for cholesterol that can make heart disease, coronary artery disease worse, right? And seeing someone who has that background or knowledge in what Williams is can help guide that going forward. And that's another big challenging area, is finding adult providers out there that are familiar enough with the syndrome, because syndromic disease is really important in pediatrics, because that's when diagnosis happens. That's when all these things are changing. And then you go into the adult world and it's really hard to find experts in those areas, those subspecialties as an adult. And so I think that's an area that we can kind of help find those people that do have that background and that knowledge.
Yeah. And does your clinic talk with other clinics? Like, do you guys all like collaborate and share best practices or share research that you're finding? Or is like fighting for people to come? I don't know how it works.
No,
right? Like,
absolutely not. Absolutely not. So we are a part of the WSA has something called a clinical consortium. And what it is that's the group of Williams syndrome clinics that are all kind of working together to try to develop a national registry. Dr. Pober has developed a registry at Mass General, and she's been doing her own for a long time, right? And so they're working to expand that to a national level, which is like really in development, and I think even launched at the last conference. And so at many places is open for enrollment. That's called CRUISE. That's a collaborative registry for Williams syndrome, right? So that is a way that we're all meeting together. One, we're helping to say, hey, what do we want to put into this registry and this database? And then also with the thought of, hey, eventually, what are we going to pull out of this? What data do we want to find out? What research do we want to get from this? And so it's a very collaborative environment. There is really no like, hey, we want your patients to come here. It's really like, hey, what are your patients doing? Because the more we find and the more we develop programs, the more we see that Williams syndrome, when I was told about it with my brother, it was 1 in 20,000. And I think we're now down to 1 in 7,500 to 1 in 10,000 is the estimated occurrence, right? And so there's not enough clinics for more than enough people, and really more resources for those people to find those clinics is going to be a huge benefit.
I'm on the
Are you the
research
furthest?
committee.
Oh, go ahead, Brendan.
Yeah, I'm on the research committee, so for the Williams Syndrome Association, which helped create CRUISE and all that stuff. So yeah, for sure.
That's where
and that's Dr. Pober and Dr. Kozel and all that have started that and launched it, and now they're looping in all the clinics to really be a part of that. And so that'll be a hot thing or something that keeps coming out with more things. I think families are probably going to start getting tired of questionnaires and things that are set out because we want to learn so much, right? We want to collaborate so much, and we want to have the data where I'm putting in data and Dr. Pover's putting in data, and then we all share that, and we can say, hey, I want to study this thing from a heart perspective, and I can pull her data and my data and make that research have better quality that way.
Yeah, and it's great. We're stumbling upon a question that somebody wanted us to talk to in a podcast, was like talking about what CRUISE is, and I don't know if I fully understood what it was until you just explained it. So maybe you could talk a little bit more about like why somebody would consider becoming a part of that registry.
Yeah, absolutely. So there's a lot of different diseases. There's a lot of groups that have formed registries, right? Registries are a great way to get the same information from a lot of people. And so really what this registry lets us do is it lets us, the people who are leading these clinics are experts in Williams, right? And it lets us formulate like, hey, what are our kind of clinical questions? What do we really think there are areas to improve medical care, to improve care for anxiety and those other things? Like where are the areas we want to focus on? And when we decide on that and agree on that as a group, we can go to the registry. We can say, okay, this is what we want families and people with Williams to be putting into that. This is the questions we want answered from their side. But at the same time, we're also putting in information from a clinical side. So we're putting in dosages, and we're putting in medications, and we're putting in from my perspective, we're putting in gradients from the echoes and things like that to say. So there's a lot of clinic facing data that we're putting in, and there's also patient facing data that families put in to say, hey, what is this like from an anxiety perspective? What have you found to work? So it kind of melds those two worlds together with more numbers so that we can then go to research and say, hey, how does this anxiety med work in Williams? What do families say? What do clinicians say? What kind of dose does it take? And then instead of just one little group or one, a psychologist or a developmental pediatrician saying like, oh, this is what has worked for my small group. Like, what has worked for a bigger group? Like, and is there something to that we can use, to expand out and be better at caring for some of the conditions that we see in Williams. So it's a really cool opportunity. There's a lot of building that goes in. So I don't think it's going to be a fast process, and you're going to have all sorts of data to put in at one time. I think we're trying to be thoughtful about what data we want first, and what's the process, and then at some point other groups that aren't part of the consortium can reach out to us and say, hey, we would like to study this, could we use this data for that? And then we develop a process for them to deal with that.
What do you think people with Williams syndrome can do for heart health, for like a daily basis kind of thing?
Yeah, I think activity is the biggest thing. So regular activity, right? That's for anybody. That's for anybody's heart health, right? Obviously, that comes with questions. There are some degrees of narrowing that are so significant that there are restrictions applied. Usually, in those cases, that's still, hey, we want you still doing this. We want you still doing this level of activity, right? But I think that's the biggest thing, is not just sitting around, not just doing nothing like most Americans tend to do, that I'm guilty of a lot of times too. Yeah. That's the biggest thing, because the more you can keep your blood pressure and those changes in blood pressure normal, meaning putting your body through its normal increase in heart rate, increase in blood pressure with exercise, the better it is in its relaxed state. And so I think that's a big thing that I think is a big need throughout the community for sure, is regular exercise, and what exercise will be reproducible and something they can stick to, and something that over time will provide heart health. So,
any supplements or anything that you like? I know Stella's on a fish oil supplement, but is there anything that you go in addition to your regular med management? Like, these are some things that we found have been beneficial.
Yeah, really that's on a kind of a case by case. Like if the cholesterol seems to be higher than we'd like it to be, if we're checking that regularly. Some people elect to do it just to try to keep cholesterol low. That fish oil is a benefit for that, for like triglycerides and things, for those things. But there's nothing, like supplement or something regularly that I'd recommend for everyone with Williams, right? And we're watching. We have many patients are on blood pressure medicines, trying to keep that down and in reasonable levels. That helps reduce the risk not only of heart disease, but also of stroke later on in life too. And so that's something that we're intentional about. I think what I've learned is that family, I think parents first and foremost, but then also siblings, grandparents are the people that do this work, because they know someone well who's really changed their heart for it and seen the beautiful things that are part of Williams syndrome. Like, I take care of the things that aren't so beautiful, right? The cardiovascular problems aren't the great part, but there are so many great things, and I think it's the people that really change and really drive us to do what we do, right? It's not that I'm so interested in what the blood vessels do, right? I am kind of a nerd that way, but a lot of the time it's because of the people behind it, right? And the families I get to interact with. And I think having grown up with someone with Williams, I think that has given me kind of a window when people come with a new diagnosis, or come and are learning about it for the first time, that are terrified, like you said. My parents went through that. I not directly, because I was a teenager at the time. So, didn't as much have that same internal struggle, but I think over time have developed just a respect for people with Williams and what they bring, and the joy that comes from a lot of the things that they can do and that they're involved in. And so I think, siblings are a huge part of this, just as parents are. Most of the people in the involvement as parents, and they're driven because that happens. But siblings have the same window, the same perspective, and maybe even a little bit of different perspective, right? That can push this stuff forward. And with the way that we're connected to people these days, things can grow and change a lot quicker. So I think that families, grandparents, and everybody else that are motivated to be part of these things like this registry and just getting information out there to the medical community is going to benefit everyone in the long term. And so that's kind of my perspective, and from my experience, I think that's what pushes me to keep doing it, is that personal experience. Of course, that's what you fall back on all the time. But the more I get ingrained in the community, the more I want to be a part of it, because you just see some of those similar characteristics that just make you love people, and actually love the syndrome. And it's sometimes a strange thing to say, right?
This has been the Starry-Eyed Podcast, presented by the Williams Syndrome Association. The show is hosted by Jennifer Keaton and Brendan Lemieux, and produced by me, Joel Liskman. Theme song by Tommy Barbarella and Mariella Elm. Got a question for the show? Email us at podcast@williams-syndrome.org or message us at the Starry-Eyed Podcast page on Facebook. Video version of the podcast available on the Williams Syndrome Association channel on YouTube or on Facebook. Rate and review us on Apple Podcasts or comment on the video version and maybe it will be featured on a future episode. Make sure to like and subscribe to the Starry-Eyed Podcast wherever you get your podcast delights.